All right. We're going to get started. Thank you so much to everyone for being here this evening. We're really excited to have this conversation with everyone about WIC. And I think that we're ready to get started. So first of all, who are we? A word or two about your presenters today. My name's Alex. I am part of the AmeriCorps program working with Hunger Free America this year in the Child Nutrition Department with Juliana. And these are my presenting companions.
Hi everyone, my name is Juliana. I'm the Child Nutrition Programs Manager at Hunger Free America, and we work towards education and outreach around federal nutrition programs.
Hi everyone, my name is Andrea. I'm a WIC benefits specialist. I help individuals apply for WIC in all the 5 boroughs. So I'm here to answer any questions that you may have.
And again, if anyone's interested in throwing name, maybe your borough, and if you have any kids in school in New York in the chat, we'd love to learn more about who's here if you're comfortable. So our organization that we're working with is Hunger Free America. We're a nonpartisan national nonprofit group working to enact policies and programs to end hunger and ensure that all Americans have access to food and nutritious food. And then also on the more local level, we have a branch of our organization called Hunger Free NYC, which does a lot of direct service work, helping New Yorkers access nutrition programs right here in New York City. And Andrea is part of our direct service team. We're really lucky to have her with us this evening.
So we're here today to talk about an amazing program called WIC. Some of you may know it as the Supplemental Nutrition Assistance Program for Women, Infants, and Children, but we're really thrilled to be talking about WIC today because WIC supports healthy families. When you're pregnant, you need vitamins and minerals more than ever. Good nutrition during pregnancy and in the early stages of your child's life is very important. And research shows that parents who use programs like WIC have healthier births and children who do better in school. So we see WIC as an amazing option for families who are interested in bringing both nutrition and breastfeeding and other support services into their life.
All right, so in a little bit more detail, what is WIC? It's a unique program because it's both a nutrition program and also a public health program. It has a component for food and also has a component for public health. It provides funding for food packages tailored to your family's need, breastfeeding support, nutrition counseling and health education, and also referrals to other health and social services when needed. WIC is designed for parents who are pregnant, breastfeeding, or postpartum, whether that be because they've recently given birth or because they've recently had a miscarriage or abortion. It's also for babies, infants, and children under the age of 5. The general idea being that young families are eligible for this program until their children enroll in the 1st grade and start receiving support through the National School Lunch Program. It's also parents, sorry, Juliana, can I hop back for a sec? Yeah. Also, caregivers of children, including dads, grandparents, foster parents, and aunts and uncles, also participate in WIC. And then 3 really important things we want to emphasize before we dig into a little bit more about how each piece of the program works. Number 1, WIC is not part of the public charge. This means that participants in WIC are not going to be denied legal status because they participated in WIC. It doesn't increase your risk of having a hard time getting a green card. And this also applies to SNAP, also known as food stamps. The second fact is that WIC is not just for moms and babies, the way that it's often, a lot of the marketing you see has moms and babies on it, but it's also for primary caregivers, including dads, foster parents, grandparents, who can apply on behalf of eligible children that they're taking care of and receive WIC benefits. And number 3, WIC does not take your immigration status into account in the application process. And this is a really, really special thing about WIC. A lot of social services programs are directed at citizens, but WIC is not. Any child and any child caretaker can apply for WIC regardless of their legal status in the US.
Hi, so now I'm going to talk a little bit about the food package, which is part of your WIC benefit, which comprises a bunch of different pieces. So the food package is something that you work together with your WIC nutritionist. It's based on many different factors, such as your pregnancy, stage of pregnancy, age of your children, nutritional needs, food restrictions, intolerances, preferences. Your food package will also include a selection of healthy foods like infant cereals, yogurt, fruits, vegetables, whole wheat pasta, brown rice, 100% juice, whole grain products, canned fish, peanut butter. You can see that there are a lot of different options that will be part of your WIC package. These items can be obtained at authorized retailers using an eWIC card. We have an up-to-date list of WIC approved foods here if you're interested in seeing that, as well as a WIC food guide that will drop into the chat. So where can you use these benefits? They can be used at many of your local grocery stores, supermarkets, delis, farmers markets, and pharmacies, all within your neighborhood. There's a great resource here to check out the nearest WIC vendor in your area. You can also look out for these types of signs in windows that will indicate someone accepts your WIC benefits. So another piece of your WIC benefit package, in addition to the food package, is nutrition education and counseling. You and your nutritionist will work together to help you develop healthy habits, lifestyle habits, and teach you about how to cook healthy, delicious meals at home, how to shop for healthy foods at the grocery store, what to eat during your pregnancy and breastfeeding stages, as well as what to feed babies and growing kids.
So now that we know what WIC provides, how do you sign up? How do you get involved? And how does the process work? The first step to being part of the WIC program is to set up an appointment at a WIC center to apply for benefits. And when you do this, each member that is applying for WIC goes to the appointment. In normal times, that would be in person for each member of the family. Currently, sort of depending on different centers in the city or where you are in the country, you may not need to go in person to apply, and you may be able to receive your benefits remotely. And when you go to that appointment, what you can expect is a review of documents showing eligibility, a nutrition assessment, which includes a health assessment, which includes a little fingerstick blood test. You will receive your eWIC card to do your supplemental food shopping, and there will also be nutrition education and counseling provided from a nutritionist. Here we have the eWIC card. Previously, WIC participants would receive a book of WIC checks, which many of you are probably familiar with, have seen or used in the past. Now WIC is upgraded to the eWIC card. This card functions just like a debit card. You just need the physical card and your PIN to use the card at the grocery store. Benefits are loaded onto the card for every 30-day cycle. So basically every month benefits are loaded, and benefits for the entire family are loaded onto the same card. Families can buy food whenever is most convenient for them and however many different purchases works for them. And they can also share the WIC card and the PIN with other people. So if, the WIC card is given to mom and then she wants to hand it off to a grandfather to do shopping while she's at work, just hand off the card and the PIN and granddad can go and do that shopping. You can also use the card at a lot of farmers markets around the city. So we're also going to drop a link to some farmers markets that are currently accepting WIC. Here is a little bit of information about the WIC to Go app. There's an application for WIC, just like everything else. It's a mobile app downloadable from the Apple or Android App Store, and it features your specific benefit balance, approved foods for WIC, a UPC scanner. So in the grocery store, you can pick up a food object, scan the little code on it, and the app will tell you whether it's eligible for WIC, which is super useful. It also has locators for clinics where you can apply for WIC, and stores that you can use WIC at, as well as an appointment tracker for your upcoming appointments at the WIC clinic. This is an example of a WIC shopping list. Because benefits are no longer listed on books of checks, you'll receive a household shopping list each month that contains all your benefits for the benefit period that have been determined by you and your nutritionist. So here on this example, it's a little bit blurry, but you can see there's 16 ounces of cheese, 72 ounces of cereal. This is a specific shopping list of nutritious foods that has been crafted for a family in order to help them meet their needs just in terms of eating and also in terms of nutrition. And you can also access this list by calling the benefit or by calling the WIC customer service line, or which is the number on the back of the eWIC card, or also sometimes at a supermarket, you can receive this list in the form of a receipt from the seller.
So there are a few add-ons to the WIC program to increase consumption of fruits and vegetables. One of them is called the WIC Cash Value Voucher, or CVV. This program was created in 2007, and it really expanded the WIC food basket to focus more on fruits and vegetables and to better meet dietary guidelines for Americans. These checks are issued in your card monthly, and they can only be used for purchasing fruits and vegetables that are fresh, frozen, canned, or dried. Now, the two levels of the coupon are $9 a month for children and $11 a month for mothers. However, due to COVID-19, they've increased this benefit amount a lot. Right now, children are being allocated $24, pregnant postpartum parents $43, and breastfeeding parents $47. So you can see that that's a really big bump up, and our clients have really enjoyed seeing that increase in benefit amount. There are also the Farmers Market Nutrition Program checks. This program was created in 1992, also stands for FMNP, and it has two main goals. The first being to increase WIC participants' consumption of fresh fruits and vegetables, and the second is to increase awareness and support of local agriculture. So each booklet contains 5 coupons, each which is valued at $4, and one booklet is given per participant that is over the age of 9 months that is currently receiving a food package. These can only be used at authorized farmers markets, farm stands, some mobile markets as well. But if you look and see the blue sign on the left, you'll find, just like the WIC signs, that those will generally indicate that someone is accepting this benefit. So we've spoken a lot about all the awesome, fantastic benefits that come with the WIC program. But now we're going to speak a little bit more about eligibility and how to actually apply. At the basic level, to get WIC, you and your child, the child under your care, must live in the state where you apply. And please remember, citizenship, immigration status is not required. This is a wonderful program that does not exclude non-citizens. So after that basic eligibility, we look to the category, which is, as Alex mentioned, your status. So are you a pregnant, postpartum, or breastfeeding parent? Do you have infants and children under 5 years old under your care? There's a great rule called adjunctive eligibility, which basically allows you to be automatically eligible for WIC if you're already participating in a program such as Medicaid, SNAP, or TANF, which is also known as cash assistance. And that's because they've already verified your income in order to participate in those programs. So you become automatically eligible to participate in WIC. If you're not enrolled in any of those 3 programs I mentioned, your household composition will be requested to determine what is the appropriate income limit for your household. And that income must be under 185% of the federal government's poverty guidelines for the household size. There is this great online tool for pre-screening on the USDA's website, and you can easily screen your eligibility in the comfort of your own home if you are interested in finding out if you're eligible.
All right, so that slide with the eligibility requirements is chock full of information, and I want to go through it piece by piece to make sure that this is something that is being understood. So first is the category section for eligibility. And the category section is the most simple one. Are you a parent who's pregnant? Are you breastfeeding? Are you a parent who's postpartum? Postpartum parents are eligible to receive WIC for up to 6 months after the end of their pregnancy. And it doesn't matter how the pregnancy ended. I want to reiterate that, whether the pregnancy ended in childbirth or an abortion of any kind, the parent is still eligible for WIC. Breastfeeding parents are eligible for up to 1 year postpartum if they continue to breastfeed at least once a day, which is awesome. This affects their food package and also is part of the benefits for breastfeeding parents, including help with breastfeeding. And infants and children will be eligible for WIC up to 5 years of age. The next piece is the income piece, which, as you can imagine, is a little bit more complicated, but it's not too bad. The first way to be eligible for WIC based on your income is adjunctive eligibility, which basically is a question of, are you already in a program that has an income requirement? And if you're already part of Medicaid or temporary assistance for needy families or supplemental nutrition assistance programs, so if you're in Medicaid, TANF, or SNAP already, then when you go to your WIC appointment, this will automatically make you eligible for WIC because you've already jumped through the hoops, you've already proven that your income is at an appropriate level for one of these social services, and you can be automatically eligible for WIC without having to do any more calculations or show any documents about your income. If not, then with your WIC specialist, you are going to figure out what your income level is, whether it's appropriate for the WIC program, based first on your household composition. So household composition, by the definition used by the government, is one individual or a group of related or unrelated individuals who are living together and who share income and the consumption of goods and services. Often this just means a nuclear family, but this definition can also include different, a family with extended relatives, potentially a close group of friends who are living together. This definitely sets it up so that whatever your family situation is, however you're sharing your resources, that can count as your household. And this is something that you can discuss with your WIC specialist. They're going to ask questions like, who lives at your address? Who's paying for all the food and living expenses? Who shares the living expenses? Who's earning the money for other members within the household? And that will allow you to determine what the number is of your household. So this picture here would be an example if this is the full household, a household of 5 members. WIC requires that your household's income be under 185% of the federal government's poverty guideline, as Juliana mentioned. So once you've established the size of your household, then you're going to take a look at the federal government poverty guidelines and see how your income lines up with these guidelines. A couple quick notes, like I hinted at in the last slide, an unborn child can be counted as a member of the household. So a household could be a pregnant mother, that would be a household of 2 people. Foster children, on the other hand, are considered independent economic units. They're automatically eligible on their own, but the way that they are incorporated into the household rule is a little bit more complicated. So here we have this table that shows some examples of household income at the 185% of the federal government's poverty income level and different households. So for example, if we had a household of, say, 3 kids, a dad, and an aunt, that would be a household of 5 people. So we can look on our chart here and see that the annual monthly income cap for eligibility for that household of 5 would be $57,424. So if the household makes less than that amount of money, which is certainly possible with 3 kids, then they would be eligible for WIC based on income. And you can also see this chart breaks things down so that if they're receiving income monthly or twice monthly or weekly, and that's sort of how their income paperwork is laid out, there's also numbers there for comparison.
Thanks for explaining about all of the eligibility requirements, Alex. In order to verify your income and your residency and your identity, you'll be asked to bring several documents. As you can see through this little screenshot of a brochure, there are a ton of different documents that you can use to apply for WIC that prove income, as well as your categories, as well as your identity and your residency. And so finally, in order to apply to WIC, there are many different ways which have really become more easier at the onset of the pandemic because we're able to do things remotely. The first application you can complete would be online on the WIC Strong website. They have a great website that you can really go through to complete your application. There's also over the telephone, so you could call the Growing Up Healthy hotline and request WIC support, as well as if you call 311, they would direct you to the nearest WIC clinic, which brings me to applying in person. You can apply at a local agency. Alex will share a list of clinics in New York City. And you could also apply with us and with one of our WIC benefit specialists. And I would love to introduce again Andrea from our presenter slide, my lovely colleague. She will be sharing a bit more about the benefits of applying with Hunger Free NYC and the different services that we provide around this program.
Thank you so much, Juliana and Alex, for providing like really good information about WIC, how to apply, and their benefits. So I want to explain to you why it is great to apply with us as well for WIC. So what we do for our clients is that we guide them through beginning through the to the end of the process. We guide them to the new application, for example. If you have any questions on what to like what documents you need, we guide them through every single step. And then also if you have to do a recertification as well, with us, since we have had good and great connections with WIC offices, we have good connections with the WIC supervisors. So there's minimum waiting time in your application process. So we try as much as possible for your applications process to be expedited and be taken care of as well. So we truly advocate for our clients. If you have any barriers encountering the application or any barriers with activating your card, for example, your eWIC card, or downloading the app, or any other questions that you may have, we are here for you to help you and guide you through that process as well. We speak several languages in-house, and if we don't have that language, we use a translating company that could help us have access to that particular language that we don't have in-house. We help our clients remotely and in person as well. And then if we identify that household or that family to have a particular obstacle or barrier in probably maybe not with WIC, but maybe with SNAP, we try to pre-screen them for other food services as well, like SNAP or maybe like a food pantry. We try to refer them to other partners that we have in our community as well, since we have several partners in all 5 boroughs. So we try to assist our clients as much as possible. So yes, and you can reach us at, you can reach us at our main hotline. We have an English line and Spanish line. Feel free to leave us a message. You won't have a live person there, but if you leave us a message with your contact information and what are you looking for and the needs that you have, we can give you a call. We always have somebody to give you a call back. And